It's one small step for man, one giant leap for mankind.
The NASA James Webb Space Telescope is a piece of technology that will prove itself extremely useful in NASA's mission to explore the early universe. The telescope showcases many innovative features and technologies developed by NASA's Goddard Space Flight Center. Among these technologies are telescope lenses that measure infrared light and convert it into images that scientists can view and analyze. Since the infrared light it takes in has a larger wavelength than visible light, the telescope essentially looks back in time by receiving infrared waves emitted by the Big Bang 13.8 billion years ago.
Another technology NASA developed for use in the JWST was the Scanning Shack Hartmann System, which was used in the mirror creation process for the telescope. Since the telescopes need to be able to see extremely deep into space, mirrors created for it need to be precisely crafted. The Scanning Shack Hartmann System was able to measure the surface of the mirrors immediately after the grinding process to see if it was crafted into the correct curvature, which saved large amounts of time during the construction process. This system spun off into the iDesign Advanced Wavescan Studio, which is used to measure the patient's eye before LASIK treatment and create a visual guide for how to correct the patient's vision. This spin-off decreased the time needed for LASIK surgery and increased the accuracy of the procedure.
Another area that the software could be applied is surgery to repair comminuted fractures. This is a fracture in which the bone is broken into several pieces. When a bone shatters like this, the doctors must perform a surgical operation to repair it. This includes cutting open the patient at the point of injury and resetting the fragments back to their original place, sometimes using a special glue to keep them from breaking apart again. To make this process easier for doctors, we can use the Scanning Shack Hartmann technology to map a diagram of the fracture and the bone fragments. This process would quickly create an image of the fracture and show the doctors how the bone fragments should fit back together into the main bone. If the fragments need to be glued back together, the diagram would show how much glue to put in the spots. This system would make surgeries for comminuted fractures more efficient and more accurate. That concludes our video.
Thank you for your consideration and allowing us to participate.